All right, folks, welcome into the Newport This Week video podcast series. I'm Bill Bartholomew. Remember, you can find all of our episodes on the Newport This Week YouTube channel. And remember to pick up the paper each and every Thursday. There's always, well, it's cover to cover, as they say, filled with great stuff. This is National Nurses Week, and we're highlighting an important program today that is fairly new to Newport, and we're kind of rolling it out because it's such a critical and important program that there's really no other words for it. It's just critically important for our community. And we're joined by Laurie Clements, who is the Sexual Assault Forensic Examiner Program Director. And she works across all emergency departments within the lifespan system, including Newport Hospital. The program is described as a valuable service to the community, and Laurie is described as a fabulous RN and an excellent example of the important work and role that nurses play within our healthcare system. Good morning, and thanks so much for making the time, Laurie.
Good morning, Bill. Thank you for having me.
So let's talk about the origin of the program. How did it come to be?
Sure. So our medical director for the program, her name is Dr. Susan Duffy. She has been passionate in working with this population for many, many years, but she applied for a grant through the Department of Justice and Office of Victims of Crime, and Lifespan received the grant, and they also matched the grant. So that's why we're able to start this program at Lifespan.
Let's talk about the hyperlocality of it and where and when it's available at Newport Hospital.
So this is a program we just rolled out in January. It is available at all the Lifespan EDs, including Newport Hospital's emergency department. It is a program that is 24/7 on call. We have a team of folks that are primarily nurses, nurse practitioners, and also physician assistants that will respond to cases where patients come in, report sexual assault, and the care team in the ED will let us know, and our team member responds to take care of the patient there at Newport Hospital.
So who conducts, once that response happens, who will the victim be dealing with in person in this program? Who are the safe examiners?
So the safe examiners, like I said, they're nurses, and all of our team members, including the nurse practitioners and the physician assistants that are part of our team, they will respond to the ED. And so the one team member responds to provide comprehensive medical forensic examination to the patient, which includes collecting forensic evidence for that particular patient.
So that it kind of plays into, look, you know, this is one of the most horrific aspects of our society, and it suggests that at a certain level we're uncivilized, right? That this type of crime is at so many different levels, right? It's not, it's persistent across so many different aspects of society, and it takes place in so many different ways. And when I say levels, I don't mean levels of society, I mean levels of relationships, parental, spousal, neighbor, and of course, random. So with that background, why is a program like this specifically needed? How does this go above and beyond what is already in place or what has already been in place for decades?
So obviously, medical professionals are trained to take care of patients for many different reasons. So our team, however, is more specialized. These types of, the type of care that it takes to take care of a patient like this, to do a comprehensive exam and provide the patient with a trauma-informed approach, as well as the care and the resources and the follow-up that needs to be discussed, can take up to 4 to 6 hours to take care of a patient, depending on what their needs are. So obviously in an ED setting, that can be challenging for medical providers. So our team members have been specially trained based on national protocols through the International Association of Forensic Nurses. And they receive clinical training as well as classroom training or coursework training. And then we are all trained in the same manner. So our approach to patients is a coordinated approach, but we work in conjunction with the ED team.
How can someone access the program?
So they just need to come to the Newport ED if that's where that what's closest to them. So whichever lifespan emergency department, but if in Newport, it would be the emergency team in Newport. They would see the medical team there first, and the medical team would reach out to our specialized team to come and provide care.
Hate to ask this, but has the program already been used yet at Newport Hospital?
Yes, we have unfortunately seen a handful of cases. I would love to say I'd like to be out of a job someday where my services aren't needed, but we're privileged and happy to be able to provide this service to patients that present to the ED.
I mean, what a topic. I mean, like, how do you do a great job of establishing the information dissemination and informing people on something that, like I said, it's just a horrific pox on our society, and but at the same time, it's a reality, and the care and the trauma informed response is so critical to what you do. So I think it's just a spectacularly important component of an integrated healthcare system that is, it's a specialization that is so nuanced. I guess my last question, talk about the balance of medical science and social science and just human interaction, almost art that has to go into something like this.
I think the staff that we have can provide a lot of patience. Again, in emergency departments, it's fast paced. You're tasked with taking care of a lot of patients. Our team members go in and their sole purpose is to take care of this one patient the best they can. They take the time to listen to what's happened to them. They work with other folks that may present with the patient, so a family member. We talk about resources and follow up and what trauma may look like for them or their response to their trauma in the future. So we do provide a lot of information to the patient and a lot of support afterwards, which can also include medical care and follow up afterwards, because when you experience trauma, you can have a lot of chronic health care conditions that may develop in the long term afterwards. So it's really important to get the care up front.
And this program, I should add, is available to men, women, non-binary folks. It's available to everybody, right?
It's available to everybody. Our team primarily sees patients 16 years and up. However, that doesn't negate anybody can go to Newport Hospital to get care, and we will provide what services are necessary. So there is already an established program at Hasbro Children's Hospital, the Aubin Center, that provides care for younger patients.
Laurie Clements is the Sexual Assault Forensic Examiner Program Director across Lifespan's emergency departments. And on this National Nurses Week, a critical and just heroic program that you are involved with here. And boy, in an area that is, you almost don't want to talk about it. You almost want to be like how do you have a normal conversation about something like this? You know what I mean? It's normalizing it at any level is unacceptable, right? At the same time, your sobriety to be able to bring it down to a very clear communication level is so impressive and so, I think, calming for the community. And it's a great aspect of our, like I said, our integrated healthcare system here in Newport County. So thanks for your time, and more than anything, thanks for your work.
Oh, thank you so much. Thanks for having me.